Can you hear me up the back? All good? Welcome to Perth, welcome to Convention. It's a great pleasure for me to be here. A bit of an introduction there. I am an obstetrician and gynaecologist, and I didn't make up the name of this talk, but well, it's not a bad landscape. I can talk about just about anything with this. I am the immediate past president of the Australian Medical Association. I could have potentially spent half an hour talking to you about Doctors' Health mandatory reporting, the efforts that I went to through the AMA to seek an exemption to that. One of the themes that I hope will come out of today's talk is how the AMA is working hard for you. And of course, my invitation to talk today is based on something else very important about me. If the clicker works, maybe it's not going to work. There we go. I am, of course, a former president of the Australian Medical Students Association, and that's what makes me really important in this room. So one of the great joys about being president of the AMA is that you do get to meet the real decision makers. You get to actually make a difference. You get to talk to senior ministers from the Prime Minister down, and it's very important also that you maintain open dialogue with the opposition and the crossbench, because they are potentially the future government. There's a picture down there at the bottom of Susan Lee. That was about I took her to my GP here in Perth, and she wasn't the health minister within about 6 weeks of that. So it can be dangerous going and seeing my GP here in Perth, but you never know. You never know who's going to be the minister a couple of minutes later. What's the AMA? The AMA is the peak organisation representing the medical practitioners and the medical students of Australia. The mission: leading Australian doctors, promoting Australia's health, and two key objectives: to maintain, promote and advance the interest of its members, but just as important, to promote the well-being of patients, taking an active part in the promotion of healthcare programs for the benefit of the community. So that means that the AMA also has a brief to talk about major social issues. The thing which drove me most during my time as president of the AMA, and for that matter my participation on committees going all the way back to being a medical student, is medical ethics. You see there the Oath of Hippocrates, and then the Declaration of Geneva. That is the penultimate version. That was recently updated last year. I'll talk more about the updates to the Declaration of Geneva later. So what's ethics? Is it the same as morals? Well, both of them refer to what's right and wrong, and while the terms are sometimes used interchangeably, they're very different. Ethics refers to rules provided by an external source, whereas morals are something that are inside yourself. That might be your own personal view about what is right and wrong. And as many of you will know, ethics and the law are very different things. In most cases, the ethical duty of a doctor sets a higher bar of expected behaviour than legal duty. That was a really important point that was made in the talk there about mandatory reporting. The thing which scares sick and impaired doctors so much is that they don't know where that bar is set, and that's why it's absolutely essential that the AMA, beyond my presidency, continues its advocacy to see doctors get the same exemptions so that they can seek help in the other 7 jurisdictions. That's a long, busy slide. I won't go through it, but of course ethics affects you every day without you thinking about it. The AMA's role is to develop a code of ethics, but we've talked about a lot of things like the stewardship of limited healthcare resources, about professionalism, and about things that you might not think about, like conscientious objection, disclosing medical records, acting as medical witnesses. It's complicated. And of course, it's ethics which, to one extent or another, informs the public advocacy of the AMA. And there's just some things where the Ethics Committee has contributed to the advocacy of the AMA, whether it's reproductive health, end-of-life care issues, prisoners, asylum seekers, refugees, ethical issues in disaster response, genetic testing, organ transplantation. These are all very complex issues that are a lot more complex, and you only realise that once you dive deep into the ethical issues. One of the things the AMA does every year is produce an Indigenous health report card. One of the 2 report cards produced during my time as president was a call to action to end new cases of rheumatic heart disease in Australia. a disease that has all but been expunged from the non-Indigenous community in Australia, a disease of poverty. Rates in Aboriginal and Torres Strait Islander people in the Northern Territory are 55 times those of non-Indigenous Australians. It is the classic example of a social determinant of health. One of the AMA's important roles is to shine a light on these issues, and on that specific issue we help bring together a broad coalition of advocates, academics, bureaucrats and governments to start to make moves to remove this entirely preventable disease from the Australian landscape. One of the ways that we get to do the job is through advocacy in the World Medical Association, and there's some nice slides from Livingstone in Zambia. I was a councillor of the World Medical Association between 2016 and 2018. You're talking to people from countries, cultures, health systems that are extremely different from each other, but there are some things that unite physicians across the world, and we produce policies on things like regulations in times of armed conflict and various declarations, including only the 5th reiteration of the Declaration of Geneva, the Physician's Oath, and just to capture the spirit of that last session, a new line which implores doctors to consider their own health, recognising that healthy doctors provide better care to their patients. The AMA produced a position statement on marriage equality. Now that's something that in my experience people of your generation find it hard to comprehend that you'd even need to produce a statement on this. But it was very challenging for a minority of our membership. The AMA was the first organisation in the health industry to call on the Australian Parliament to legislate for marriage equality, and we outlined the health implications of excluding any group of individuals from a key institution of society. The AMA from time to time will weigh in on social issues, calling out discrimination and inequity in any form, especially where it affects people's health or their well-being. The AMA has a different position statement to AMSA on euthanasia physician-assisted suicide. 117 of the 119 nations making up the World Medical Association have statements against euthanasia physician-assisted suicide. Our statement, which went through an 18-month-long review, brought back out in 2016, retained the policy positions that doctors should not be involved in interventions that have as their primary intention the ending of a person's life. The AMA position continues to support the old doctrine of double effect, where the administration of treatment or any other action intended to relieve symptoms, which may have the secondary consequence of hastening death, is both ethically and legally appropriate. But the 2016 statement also made some new statements. It acknowledges the fact that laws in relation to euthanasia, physician-assisted suicide, are ultimately a matter for society and its parliaments. It also states that if governments, as they have done in Victoria, decide that laws governing euthanasia, physician-assisted suicide should be changed, doctors must be involved in developing relevant legislation, protocols and guidelines which protect all doctors acting within the law, vulnerable patients, vulnerable groups of patients, patients, doctors and healthcare providers who do not want to participate, and it mustn't affect the functioning of the remainder of the health system. The statement also advocates that end-of-life care and palliative care services should not be compromised, as they have in other parts of the world when there's been legislation of euthanasia or physician-assisted suicide. So again, you do get to meet the important people. So where did my journey start? Where did my journey from the birthing suite to the cabinet start? Well, it started a long way before that. Many of you are familiar with this statement. There's a lot of arguments about what Virchow actually said. He didn't say this, he was German. But he said, roughly, that medicine is a social science and politics is nothing else but medicine on a large scale. So do you think I worked that out when I was 17? No, of course I didn't. What brought me to being president of AMSA and a much younger looking person with a particularly poor haircut back in 1993? What brought me to that journey? Oh, maybe I'll keep that slide right to the end, how I ended up in my journey from the birthing suite to the cabinet. But what I'd really like you to all reflect on is how important it is for you all to get involved. I do want you all to think about what Virchow said, and I want you to think about how, while it's so important that you focus on that one patient in front of you, that you think of the health system as a whole, and you think about fairly sober topics like resource allocation, sober topics like antimicrobial stewardship. When you think about things that I know so many of you are committed to, like the environment, like clean air, like clean water, like food security, like water security, and make that contribution. So how do you make that contribution? How do you show leadership? Well, for a start, you engage. These are some important things that I would encourage all of you who are already showing that you are leaders by being here at convention. These are the things that I hope that you will espouse. Engagement, honesty, communication, inspiration, respect, and commitment. So what do those words mean? Well, engagement means getting involved. You're already doing that. I hope many of you will get involved with the AMA. It remains the organisation that has the greatest ability to impact on the lives of doctors and their patients, but there are plenty of other important organisations. I'm now on the board of a medical defence organisation. I've previously been involved in my college. Just get involved at any level and share the burden so that some of you do the work at hospital level, some of you do the college work, some of you do the AMA work, some of you do the MDO work, some of you get involved with Doctors' Health Advisory Services. Get involved. Honesty is so important, but so is integrity. Communication, you all know, is important. But communication involves not just speaking, but listening. You all have one mouth and two ears. Use them in that ratio. Inspiration and aspiration. You can do better. You need to be positive about the changes we want to make about doctors' health. You need to be positive about the changes to make not only the health system better, but to make our whole society better. Being a good leader involves respect. You will inevitably work in teams. Now, whether that's in your clinical work or in any of the organisations that I would encourage you all to get involved in. Respect means understanding diversity. It means celebrating diversity. It means understanding that different people have different abilities and different motivations for being in the meeting room with you. And commitment is so important. You don't just turn up to the meeting without making a contribution. That means hard work. That means having the ability and the skill to delegate and to let someone else shine, to let someone else do the work. And it means trusting other people to do that work. So the journey from birthing suite to cabinet and influencing politics and the effect it has on all our lives had to start somewhere. Of course, it started at convention. So I had no idea when I hopped on the train to Melbourne 29 years ago that involvement would lead me to talking about leadership, to becoming a leader in my profession. I just wanted to go and have a hoot of a time in Melbourne. It took 3 days on the train. I'm making myself feel very old now by saying that medical students couldn't afford to fly across the country in those days. You can get up to a lot of trouble in 3 days on a train. And then in second year, we drove to Brisbane. We must have been quite mad, but again, that was a fabulous journey. So why I would implore you all to take this most important of vocations seriously, why I don't want any of you for one moment to take for granted the honour and the privilege it is to be a doctor and to look after patients and look after families in their darkest hour. It's also a very rewarding career, and you need to make sure that you celebrate it and you have fun, you enjoy the fellowship of your colleagues along the way. You are leaders just by coming to convention, and even if some of you are just here because you thought it might be fun to go to over the other side of the country for a week or so, you're showing that leadership. I would encourage you to grow on it. It doesn't necessarily mean dressing up as the German soccer team and running around Adelaide like a bunch of idiots. Thank you so much for the opportunity. I wish you the best, and it's been great to be back at convention.
Thank you for sharing your journey with us, Michael. You'll truly come full circle as past president and now speaker. I'd like to present you with this gift. Can we please thank Michael again for his great speech?